I would like to reverse suture method blepharoplasty. Any experiences of returning to pre-op conditions? Hi, I just had Asian blepharoplasty done 2 weeks ago, and I realized how much I miss my original monolid eyes. I want to get my sutures removed, but I'm worried about the results and consequences. Would you mind shedding some light on this for me? It would ease my anxiety so much. Thank you. Does anybody have any experience of their eyes returning to pre-op conditions or something close to it? I had non-incisional suture method, and it's been 12 days. Please advise, and much appreciated.
Thank you for your question. You had Asian eyelid surgery using the suture technique approximately 12 days ago, and you're now inquiring about reversal of the surgery and how much you missed your monolid. So you want to know, can this be done? Well, in looking at your photos, I'd first ask you to just consider one important factor on why your desire to go back to where you were preoperatively. And I would suspect is that you may feel that your eyelid crease is too high. It is very common for people after Asian eyelid surgery to be very concerned about an unnatural look or a lid platform that's too high. And that's basically because of swelling. By the nature of Asian eyelid surgery, whether it's incisional or excisional, where you're removing skin, removing fat, there is a connection that has to be made between the skin and the levator muscle, the muscle that lifts your eyelid. In doing that, there is going to be an expansion of fluid between the eyelid crease and the eyelid margin that results in this ballooning effect and makes the eyelid crease go high. So, if that's a concern, then talking to your doctor who performed the surgery and anticipating that with time that swelling will go down and you'll likely have a very natural looking double fold. Now, on the other hand, if you really feel that this is something you absolutely don't want and you're having a real remorse and you want to just go back to where you were, well, although I haven't had to do this in my practice, I would suggest that it is probably beneficial to do it as soon as possible. The principle of non-incisional Asian eyelid surgery is to, through little skin openings on the outside of the eyelid, to place a suture at critical points to engage the area of the muscle, the levator muscle, and the skin in such a way that when you tie the knot, you actually create a fold. Now, that fold is what creates the infolding of the skin. We actually do a procedure for creating dimples, and in many ways there's similarities where we create a little pull on the skin on the inside of the mouth to create a dimple and fold it inward. So the same principle applies, and so releasing those connections can be done, and is probably better to be done sooner rather than later before the formation of scar tissue occurs. So that being said, I think time is of the essence for you, and meeting with your doctor and having a discussion about what the realistic results will be when the swelling will resolve versus complete reversal of the surgery, and then just choose whatever you're most comfortable with. So I hope that was helpful. I wish you the best of luck, and thank you for your question.